Press 2 fingers right above your ankle bone and hold for 5 seconds. Now let go and look. If there is a dent sitting there in your skin that takes several seconds to fill back in, your body is telling you something, and most people your age have been ignoring it for years. That dent is not just water weight, it is a sign that blood is pooling somewhere it should not be pooling, and if that pooling is happening in the deep veins of your leg, it can turn into something that travels to your heart or your lungs without a single warning first. If you are new to this channel, welcome. I put out videos like this one specifically for people building healthier, longer lives after 50. And if any part of today helps you, sticking around costs you nothing, and it means a lot to a channel that is just getting started. By the way, my name is Dr. Matthew Clark. I am an internal medicine and preventive health doctor, and I have spent the last 15 years working with patients just like you, men and women over 50 who are trying to catch problems early instead of finding out about them in an emergency room. I want to ask you something before we go further. Think about your day yesterday. How many hours did you spend sitting in one chair without really getting up and moving your legs? Not exercising, just moving. Most of my patients cannot answer that question with a small number, and that is exactly why this topic matters. I am going to walk you through 3 exercises today, and I am doing them in a specific order on purpose. The first one most people already sort of know. The second one surprises almost everybody. And the third one, the one we save for last, is the one my own patients tell me change their legs the most, and it takes about 90 seconds. Here is the part nobody explained to you properly. Your heart does not do all the work of getting blood back up from your legs. Your calf muscle does a huge amount of that job every time you take a step, squeezing the veins in your lower leg the way a sump pump in a basement pushes water back up and out before it can collect. Inside those veins, you have tiny one-way trap doors called valves. Every time your calf muscle squeezes, those trap doors let blood move up toward your heart and then snap shut so it cannot fall back down. When you sit still for hours, that pump stops working, those trapdoors stop opening and closing, and blood starts to sit. When blood sits still long enough in a deep vein, it can start to thicken and clump. Doctors call this deep vein thrombosis, and all that long name really means is a blood clot that has formed deep inside a leg vein instead of on the surface where you would actually see it. Here is the part that keeps me up at night as a doctor. That clot does not have to stay where it formed. If a piece breaks loose, it can travel up through your veins, through your heart, and lodge itself in your lungs. That is called a pulmonary embolism, and it is one of the most sudden, silent medical emergencies a person over 50 can face. Most people believe this only happens to someone on a 14-hour flight or someone recovering from major surgery. I understand why you believe that. It is the version of this story that makes the news. But in my own practice, the far more common cause I see walking through my door is nothing that dramatic at all. It is you, sitting in that same chair, for hours, most days, week after week, for years. Long flights and surgery raise your risk for a short window of time. Daily inactivity raises your risk quietly, continuously, for the rest of your life, and almost nobody tells patients that directly. I see this pattern constantly in my practice. Someone comes in describing swelling that shows up by evening and is gone by morning, so they assume it resets itself and cannot be serious. They mention their calf feels tight or warm on one side more than the other, and they blame it on standing too long at the store. Nobody connects those small daily details to what is actually happening inside the vein until I ask the right questions. Here is something I think you deserve to know. There is no billing code for a doctor sitting with you for 5 minutes teaching you a leg exercise. There is a very clear billing code for treating a blood clot once it has already formed. Our healthcare system is extremely good at treating emergencies and remarkably quiet about preventing them, and prevention is exactly what today's video is about. If today's video helps you see your own legs differently, please consider sharing it with someone you love who sits as much as you do. This channel is brand new, and every single share right now helps me reach one more person before their own warning sign gets ignored the way it almost always is. I am building this channel from the ground up specifically for people over 50 who want real answers, not fear and not fluff. If that sounds like what you are looking for, subscribing helps this reach the right people, and it costs you nothing but a tap. Before we get into your 3 exercises, tell me your age in the comments below. I ask this on every video, not out of curiosity, but because it genuinely shapes what I recommend to you specifically, and it shapes what topics I choose to cover next for this community. Here is a question I want you to sit with for a second. If a clot broke loose in your leg right now, how would you know before it reached your lungs? Most people cannot answer that, and the honest truth is, often you would not know, which is exactly why prevention matters more than detection here. I want you to notice a pattern many of my patients live through without naming it. Ankle swells in the evening. They ignore it because it looks normal by morning. Weeks later, the swelling comes with a dull ache. They ignore that too, blaming their shoes or the weather. Months later, they are in an emergency room being told they have a clot that has been building the entire time, and every one of them tells me the same thing afterward. They wish someone had shown them the 3 exercises I am about to show you months earlier. Exercise number 1 is called ankle pumps. Sitting exactly where you are right now, lift your toes toward your knees, hold for 2 seconds, then point your toes away from you and hold again. That motion alone activates the calf pump we talked about earlier. Do 10 of these right now, several times throughout your day, especially anytime you have been sitting for more than 30 minutes. Exercise number 2 is a heel raise. Holding onto a chair or counter for balance, rise up onto your toes slowly, hold for 1 second, then lower back down with control. This works the calf muscle even more directly than ankle pumps, and 10 to 15 repetitions, done once or twice a day, meaningfully improves how well blood moves back up your leg. Here is exercise number 3, the one my patients consistently tell me surprised them the most. Toe pumps done while lying in bed right before sleep. Simply curl your toes down tightly for 2 seconds, then spread them wide and hold. 10 repetitions, done in bed, keeps that calf pump quietly working through the exact hours you are most still, which is often the highest risk window of your entire day. 3 exercises, ankle pumps while seated, heel raises while standing, toe pumps while lying down. None of them require equipment, none of them require more than a few minutes, and every one of them directly targets the exact mechanism we just spent this whole video explaining. I want to be honest with you about something. After a week or 2 of doing these consistently, your legs will likely feel noticeably better, lighter, less swollen by evening, and that relief is exactly the moment most people quietly stop doing them. I want you to treat that improvement as proof it is working, not as permission to stop. The moment you feel better is the real test of whether this becomes a lifelong habit or another good intention that faded. Let me give you a clear plan you can start today. The first step, do 10 ankle pumps every time you have been sitting for 30 minutes or longer. The second step, stand and do 10 to 15 heel raises at least once in the morning and once in the evening. The third step, add 10 toe pumps in bed before sleep tonight. The fourth step, press 2 fingers into your ankle once a week and watch how long the dent takes to fill back in, and notice if that time is improving. The fifth step, if you ever notice one leg swelling significantly more than the other, especially with warmth, redness, or pain, do not wait for your next appointment. Contact your doctor the same day. The sixth step, if you already take blood-thinning medication or have a personal or family history of clotting, talk to your doctor before starting any new exercise routine so it fits safely alongside your current treatment. Before you go, tell me in the comments what your own legs have been telling you. Swelling, tightness, that dent test we started with today. And let me know what health topic you want me to cover next, because this channel is being built around exactly what this community needs to hear. Thank you for spending this time with me today. This channel exists because I believe most health emergencies after 50 are preventable if someone simply tells you in time. And I would genuinely love for you to be part of building this community from its very first videos. And one last thing, as always, nothing in this video replaces a conversation with your own doctor who knows your full history. If anything you heard today felt familiar, please bring it up at your next visit, or sooner if something feels urgent. Take care of those legs. They have been carrying you a long time.